Very good questions coming from our audience here. Here's something that's interesting because I know, when we're talking about kids, whether they be younger kids or adolescents, here's a question that I know will come up. Can this vaccine be given alongside other vaccines?
We're so pleased to say yes, that is something that was changed today. I think because we know that there's a really good safety profile for this vaccine, and when we look at giving other different vaccines together, and it's very safe, we're very happy to say that starting today, yes, you can get this vaccine also with other vaccines. And this is so important because, as Dr. Olmstead and I know, we have seen such a drop-off in kids coming in to get their routine vaccinations, which are so critically important. And so when folks are coming in to get this vaccine, if they're getting caught up on their other vaccines, they can also get their COVID-19 vaccine at the same time.
And we have been advising our 16 and 17-year-olds to not get two vaccines at the same time, mostly because we're watching so closely to see if there are going to be any reactions to the COVID vaccine. And if you got two vaccines close together, we wouldn't know. But the response to the vaccine has been so great, and the side effects have been so predictable and minimal that we really feel comfortable now that you can get the COVID vaccine with any other vaccine without any concern. So that is brand new advice that's probably contrary to the advice you might have gotten yesterday. And we are thrilled that when our adolescents come in for their well visits, that we can go ahead and get their vaccines on board and catch them up. You may know that adolescents are the group that fell the farthest behind among all pediatric groups in 2020 as far as coming in for their well visits and getting their vaccinations. So it's very important to us that we make sure that these children don't fall through the cracks. It's important to get their vaccines. It's important to get their height and weight and vision and hearing checked, but also it's really important for their mental health, for their pediatrician to have a chance to check in on how they've been doing through all of this. So we really encourage all of our adolescents to get in with their pediatrician or their primary provider as soon as they can.